So you work with people with sleep apnea. I guess that they don't want to wear their CPAP, and there's another thing. So tell me what you're doing as a dentist to get rid of sleep apnea.
So as far as dentistry goes, we can make appliances to help open their airway. It opens the way that their teeth are, as well as the airway, so that when they're sleeping, there is an appropriate amount of space for the oxygen to get where it needs to go, so that they are no longer snoring, that they get a better quality of sleep to then prepare themselves for the next day so that they're well rested and ready to do what they need to do.
Have you ever had people that had to have a CPAP, they were prescribed a CPAP, but they couldn't wear it, and now they have like a custom-made appliance,
Absolutely.
and it works?
Absolutely. It
like
happens
no more CPAP.
It happens all the time. We actually have patients coming in that are saying, I hate my CPAP. I can't stand it. I'm not going to wear it. I know I need to do something, so I need your help.
Now, so I understand this correctly. Okay, so people with sleep apnea, they breathe fine all day long, but when they lay down, what, their tongue's dropping back, their jaw's dropping back?
It's both, actually.
Okay.
So the airway is a certain diameter around, and just naturally if people sleep on their back, which most people do. So if they sleep on their back, what happens is their airway gets smaller because their tongue and their jaw go backwards and creates the smaller airway, therefore inhibiting the amount of air and oxygen that they need while they sleep.
So you just open it up?
Correct.
Like with this, just open it. Is it comfortable?
Actually, yes.
They sleep with it?
They can sleep with it. And it actually also, it's two things. It helps keep their airway open, but it also protects their teeth from clenching and grinding. A lot of patients that have airway problems take it out on their teeth, and there's a correlation between improper amount of air to clenching and grinding. So we see a lot of patients that have significant amount of wear on their teeth, which leads to a lot of other problems, and it helps protect their teeth that way.
There are certain people that they sleep in different rooms, but after you make a custom appliance that quiets down their snoring,
yes,
they're sleeping quieter, they're back in the same room.
Actually, I have a patient who should be our spokesperson for sleep apnea. He was pretty, he was kind of apprehensive about wearing the appliance at first, but he was like, you know what, I paid my money for it. I know I have a problem. Let's see if this works. So he came back for a 2-week follow-up check, and he said that he's so glad that he did it. He does not have to hit snooze anymore on his alarm. He's up, he's ready to go, face the day. He has so much more energy, and he, couldn't thank us enough for that. And so that's why we do what we do. So
now, is this true? So these people with sleep apnea, they think they're sleeping, but they're like waking up 20 or 30 times in an hour.
Correct.
Is that right?
Yes.
So that's why they wake up tired.
Correct. And they think that they're sleeping, but they also think they're getting a good quality of sleep, but they also don't know how good it could be.
So they're in bed 9 hours, but they're just not getting like a restful sleep.
Right, and they're not reaching that sleep cycle that allows your body to restore itself. So then, when they're waking up during the day, they don't want to get up, they want to hit snooze. A lot of times they're driving in the car, gets a little warm, they feel like they start falling asleep and start nodding off. So we do see those patients that come in. And of course, there's also visual signs as well. Dark circles under their eyes.
Okay.
They just look tired. They look like they're unhappy, to be honest. So now these people that used to wake up exhausted wake up with energy. They're ready for their day. They are ambitious. They have motivation to work out. They have motivation to eat well. They have motivation to be nicer to people because they're not grouchy.
So who does it work better for? The loud snorer? Or, because I know if you have a part of the snorers, you don't sleep either, right? Does it work better for the loud snorer, or does it work better for the sleep apnea patient?
So this appliance, in my belief, that it works actually well for two people. It works for the patient who needs the appliance, but it also works well for the spouse. The spouse does not have to listen to the snoring that was once happening, and now they both can get a really, really good night's sleep and feel well rested for the next day.